for today. Don't go anywhere. Stay with us.
Access to quality healthcare service should not be a privilege for the few, but a right to every Nigerian. Sequel to this, the National Health Insurance Authority (NHIA) is saddled with the responsibility of implementing and managing healthcare services to Nigerians. The vision is to achieve universal health coverage for all Nigerians, ensuring that everyone has access to quality healthcare services without facing financial hardship. And the mission of NHIA is to implement and manage the National Health Insurance Scheme effectively, providing financial protection against health-related expenses and promoting access to quality healthcare services.
Most of the conditions that we are not covered, like cancer, but I'm privileged to tell you today that cancer has been covered now, and we have 6 geopolitical zones where such areas can be catered for, and each of these political zones represent each of the zones in the all 6 geopolitical zones. So cancer has been covered now.
In case of complaints from the enrollees, the first point of call is to complain to the HMO. If the complaint is not properly addressed, the enrollee has the right to escalate it to NHIA, any of the state offices.
We have come up with what we call sanctions for defaulting healthcare facilities. I know as a federal worker, you are also a practical beneficiary of what is happening in National Health Insurance Authority. And if you look at it, we have put up measures that will checkmate quality of service you are able to access in your healthcare, in your choosing healthcare facilities. So for part of those things we have done is to introduce what we call sanction. For defaulting facilities, if we find any facility that is defaulting in the area of quality of service, we have put measures in place to sanction them. Of recent, some of those facilities that we found they were not doing very well were sanctioned.
While commending the efforts of National Health Insurance Authority, some enrollees have this to say.
The service is okay, but there are some complaints, even from me and my staffs. There are some complaints pertaining to the generation of codes to get access to some care under NHIA.
One of the things we'd like to recommend going forward, if there can be an improvement in their service, and you talk about the amount of dependents you can add to the scheme. So other than that, I think it's okay.
So, I expect more efficacy in their drugs, such that it can be more effective on our personal health. I want them to look inwards, to look at eye services and other major operations.
Nevertheless, the National Health Insurance Authority has made significant strides in improving healthcare access and quality for Nigerians. With clear vision and mission, the NHIA continues to work towards achieving universal health coverage for all Nigerians.
You're welcome back. Well, accessing quality health is a fundamental right of every Nigerian citizen. But without quality, healthcare becomes a gamble where the lives of people are at stake. It's now time for our discussion segment, and I have with me our NHIA Kwara State Office Coordinator in person of Hajia Bello Olaiton Idayat. You're welcome, Ma.
Thank you. Good morning.
Thank you. Good morning, Ma. Thank you for honoring our invite.
Thank you.
All right. Ma, we would like to know what are the mission and the vision of NHIA, that is the National Health Insurance Authority.
Thank you very much. Good morning, viewer. NHIA's vision, mission. Our vision, we are leading agency committed to achieving financial access, quality health for all Nigerians. and our mission is to promote, regulate, and integrate health insurance for all Nigerians.
For all Nigerians,
yes,
regardless of
towards
the age group.
Provision of affordable and quality health care for all Nigerians.
All right.
That is our mission.
All right. Thank you, ma'am. So why is NHIA mandatory for all Nigerians?
NHIA is now mandatory for all Nigerians because if you look at the whole NHIS Act, it's optional. It is not mandatory, and that is why the coverage was very, very low for years. And we cannot achieve universal health coverage if health insurance is not mandatory. And that is why, that is what even necessitated the new act. The old act was repealed, and the new act now enacted and signed into law on 19 May 2022 to make health insurance compulsory, to make it mandatory, and also for us to achieve universal health coverage, to reduce out-of-pocket expenses, and also to protect financial assets. And also, through that, it will enable us to achieve economic growth of Nigeria, because healthy individual is healthy community, and when the community is very healthy, that is when we can be productive, and the economic of Nigeria will be definitely grow, and everybody will be more productive. Health is wealth, and even globally everybody believe that health is wealth, and that is the only way we can achieve best result and achieve universal health coverage for Nigeria.
All right, ma, since NHIA is mandatory now, does that mean that it doesn't mean if you are from a private sector or you work in a private parastatal or for the government, is as long as it is mandatory, you will have access to it?
Yes. NHIS will have mandates, and that is why we have different programs for different segments of the society. We have formal sector and we have informal sector. For the formal sector, for public sector program, that's for those people that are working with federal, states, and also local government. Organized private sector, those that are working with medium and larger entrepreneur, they are also covered. And we have gift ship. That is our program that is leaving no one behind. And this gift ship we have for individual, that's a group individual social health insurance program that cover individual, family, and group as well. And for family, from 1 to 2, then from individual 1 to 2, from family 2 to 3, then from group from 3 upward. Then that is for groups from 10 above. That is, and there is percentage, the discounts for people under the family, that is from 3 to 9, there is percentage discounts. That's 5% for the family, and for the group is 7% discount. That is from the 10 above. Discount of 7% for the group. Then we also have the G, that is for general. If you are not keying into any of our program, so you are free to come and register through gift ship G, that is gift ship general. Then apart from this gift ship general, we also have gift ship R. For those that have retired, they can also come and register. You don't need to be panicked that how can you join. You can come and join through the gift ship hub. That is for the retirees. Then we also have gift ship C. That is for the constituency projects, health constituency projects. For those office political holders that want to key in the constituency people under the health insurance, so they can come under the gift ship C. Then we also have gift ship N for NYC. During the service year, the federal government also take their life and their health very, very important. So gift ship N is for all NYC core members. So then we also have informal sector program, the community-based social health insurance program. We have mutual health association program. Then we T-ship, that's tertiary institution social health insurance, is not even left out.
Wow.
Then we have so many programs for all the different segments.
Yes,
of the
so now it
society.
is obvious
Then-
that the federal government of Nigeria is not leaving anybody out on the
Yes.
mandates of
Yes.
NHI. It's a full cover for everyone.
Yes.
All right. Ma, can you please educate the general public in brief about the programs? Oh, you just did. The programs that are that the NHI offers.
Okay.
All right.
Yes, apart from
You just
all
did.
this
You just did,
program,
ma'am.
we also have for the vulnerable groups, because part of our priority is equity and fairness. So to be fairness enough, we must also cover the vulnerable groups along,
Okay.
because there is not any free health insurance anywhere in the world.
So
It's
the
either
vulnerable groups will be who and who?
those that cannot afford to pay on their
Okay,
own. So
okay.
those are the vulnerable group for indigents,
Okay.
because there is no free health insurance anywhere in the world. It's either you pay for yourself or somewhere pay for you. But for the vulnerable, we have basic healthcare provision fund that funded for not less than 1% consolidated revenue, but it has been reviewed to 2.0. And the more it's being reviewed, that's the more coverage and the better for the system. So the vulnerable group social health insurance program also, we cover PVF. That is part of the reform that NHI has put in place to cover the vulnerable group. Those that are having a physical vaginal fistula, so we also cover them. And Aisha Buhari at Yenkori is the designated center for the fistula in Kwara State. Up now we have covered more than 90 beneficiaries under the fistula, and we pay for the repair, and also we also pay for the feeding during the procedure, and we also pay for their transportation back to their various places. And not only that, we cover their health insurance through the basic health care provision fund. From the state health insurance agency will come and register them before they now being discharged, and they will continue to have access to health care under the BACPF.
Right.
And not
Thank
only
you,
the fistula, we also have a CMOC. That's a comprehensive emergency obstetric and neonatal care. That's CMOC. With NHIS also cover CMOC to crash all the maternal mortality and morbidity rate, and even the neonates of the beneficiary also benefit from the program. So, and apart from that, the Global Fund also take care of the people that are living with HIV and drug-resistant tuberculosis. They are not also left out from the program. They also cover, and they will assess and to reduce the burden of all these expenses of the drugs. So, and apart from that, we also cover so many things. We also partner with MAMI, and this MAMI also to crash the maternal mortality rate in the country. So to tell you that NHI is no leaving anyone
has a
behind.
wide coverage.
So that is all the program that
all right.
No one is leaving behind.
All right, ma. All right, we are still with Hajia. All right, we are still with Hajia Hidayat Bello. He is the NHI coordinator for Kwara State. Let's go for a short break. We'll be right back.
Morning Safari, your breakfast Saturday morning magazine show, is available for your patronage. From all shades of opinion to exciting and exclusive interview of personalities, corporate bodies and organizations for your business and social engagement, event coverage, product launch and rebranding, annual general meetings, we are at your beck and call. You can as well advertise and promote your business, commercial activities, hotel and tourism, entrepreneurship development, and many more are all at our services. Contact us today. The numbers to call are Bola 080-565-30106, Tony 080-349-71969, or visit us at our office NTA Ilorin along Fatih Road, Ilorin. You can log on to our social streaming platform live on www.facebook.com/NTA Ilorin. Morning Safari, we serve you better.
All right, you are welcome back. We are still on the discussion accessing quality healthcare, and with me I still have the NHIA Kwara State Coordinator Hajia Bello Olaitan Idayat. So Ma, if enrollees happen to have questions on NHIA or they encounter any problems, so what are the channels they will take to see to that their complaints are being heard?
For enrollee, if any of our enrollee have any complaint, we have instructed and we mandate all the facility to have suggestion box at the facility, so that if they have any complaint, they can drop it inside the complaint form, and all the facility have desk officers. So the enrollee can also lay complaint to the facility desk officers, and they can also call the HMO to lay their complaint, and if it is not being resolved, they can also come to NHIS. We also design a complaint form that they can fill against any stakeholder they want to complain about, and they can also see us at the NHIS call center. Okay. We have a complaint unit, okay. We have enforcement unit, okay. That we can also go and investigate on that complaint, and we will resolve it at our level. If we cannot resolve it at the state level, we will also forward it to the zonal office, and if it cannot be resolved at the zonal office also, it escalates to head office, and they will not take appropriate action on that complaint. Okay. Those are the medium that we put in place, and all NHIS offices across all 36 states, including Abuja, we have our call line that they can also call us and lay their complaint, and we can also resolve it online. Okay. And on phone also we can do the necessary thing to make sure that our enrollee gets.
All right, viewers, ignorance of the law is not an excuse. NHIA is here to give you full cover. All right, moving on. What are the collaboration that NHIA has with Kwara State Health Insurance Agency?
We have collaboration. We have cordial relationship with the state health insurance. Okay. And we also establish health insurance under one roof. This is a measure to put in place to solve all the bottleneck in health insurance ecosystem. And we also have an agreement. We have the consent that all of us we are working towards, and our aim is to achieve universal health coverage. And also we are working in conception and in agreement to achieve universal health coverage. And apart from that, there is a central coordination mechanism that we are using. We coordinate at the national level, because we are implementer, and we must ensure proper implementation and coordination of all our activities. Of course, cooperation is very, very important within us. All the enrollments from the states, they can also channel the total number of the enrollment to us, and we will forward it to head office to collate for analyze. So we have cordial relationship
with the states and the NHIA. Okay, ma. So ma, NHIA, what is NHIA doing about healthcare facilities and HMOs who does not issue referral code on time?
There will be a sanction for them. Okay. Because we have put in place 1 hour authorization code deadline. Within 1 hour, authorization code must be given to enrollee or to the facility that requested for the authorization code. And if there will be delay, the HMO must tell the facility the reason for delay, and if authorization code is not given within 1 hour, the facility that they refer to will commence the treatment, and the HMO will pay. And we have our guideline for HMO and facility to also comply with. There is sanction for anybody that cannot comply with our rule and regulation.
Okay.
Yes.
So, Ma, is there any sanction for hospitals that fail to give the required drugs to the enrollees? Or sometimes we hear, is NHIS, okay, give them this, so we don't have this, we don't have this. Is there any sanction for those
Yes,
kind of hospitals?
there is sanction. We have reviewed our price of drugs and also the procedure. So the facility don't have right to turn any enrollee down or out of stock syndrome. Is not welcome at all in NHIA, because we have reviewed our capitation from 750 to 1,450 now, just to promote standard of healthcare service rendering to our enrollee, and also to ensure that they have value for their money. So if there is out of drug syndrome, the facility supposed to go and stock for the drugs. They must get the drug ready, and they will ask the enrollee to come back for that drug within 24 hours. The drugs must be available, and they must call the enrollee that the drug is available, come and pick your drug up. And that is the law, and they must abide by it.
Okay. All right, Ma, can an NHIA principal enrollee add their children to their health insurance coverage? Let's say these children do not bear the same surname with the principal enrollee. Are they eligible for the health coverage?
Yes.
Okay, Ma.
They are eligible to health coverage. And now, NHIS, we are having ICT upgraded, that we also link our registration with the name. That's national identity management. So whenever they want to come for the registration, is their name number that we need. And once we now put their name in the system, it will bring out all their details. Then that is what we are now using for registration, and it also reduce unnecessary delay or waiting period during the registration, and it reduce fraud and also errors. So we are using name, registration number to do the capturing.
Okay, Ma. So what advice do you have for the general public and Kwara State government on NHIA, maybe the use or the whatever issue they have?
Yes. My advice for general public is that health insurance is compulsory. Let everybody go and key into health insurance, because the sickness will not tell them when it will come. And when the need arise, they will not be running scatter to get money for the treatment, and it will also reduce out-of-pocket expenses for them, and it will make them to be more productive. So everybody should go and key into one form of health insurance or the other to reduce out-of-pocket expenses, and also to enable Nigeria to have larger coverage and to achieve universal health coverage. Then for the state government, Kwara State government, I'm strongly appeal to the Kwara State government to key in their workforce. That's the state and local government staff, because without that we cannot achieve universal health coverage, and it will also enable the Kwaras to be more productive, and it will also improve the economic of the Kwara, because an healthy individual is healthy nation. And when we are healthy, that is why we can be more productive. So I'm appealing to Kwara State government to key in their formal sector program.
All right. Health is wealth.
Health is wealth.
Yes, and Hajia Olaiton Bello Idayat has given us the things we are supposed to know, the information that is important for us to know regarding NHIA. So now, ignorance of the law is not an excuse for is not an excuse. All right, now it's time for the entertainment segment where you'll be meeting your girl Olamide Babarinde. All right, see you then.